Welcome again, everyone. Thank you for joining us today for our All Hands on Deck call. I'm Carrie Jensen. I'm the Director of Operations here at National Alliance for Drug Endangered Children. And I have Sue and Sweta from our team here with us. I'll just let them introduce themselves real quickly.
I'm Sue Reeds. I'm a project specialist with National DEC.
Hi, I'm Sweta Kajurivala, and I'm the executive assistant.
Thank you both. And before we have our guest speakers share their information today, we just wanted to share one exciting announcement that we have for a new training that we have. So we have a new training and a handout that goes along with it that's called Age Appropriate Strategies for Helping Children Impacted by Substance Use Disorder. So you can see a screenshot of the handout that we have there, and if you scan that QR code, you can get to the training video, but know that that's a resource that's available for you to use and share with others as applicable. It's about a 15-minute training, but something has been super valuable as we've been able to share that with others throughout the nation. Really grateful for our OJJDP grant that helped support this, and then our great partners with a Luna Resource Center as they helped us develop that. And I will throw that link in the chat there that gets you to that handout. And that handout also has the link to the training video on that, so you can refer back to that later. But a good resource, and we hope that that is helpful to you that are all working out in the field to use that information. All right, so thanks so much. With that, I'm going to throw it over to Sue.
All right. Well, welcome everybody. It's so nice that you could join us. Today we're really pleased to have our presenters from Partnership to End Addiction. They are a national nonprofit based in New York City. Today, we'll learn more about their work and the need to start substance use prevention earlier and broaden the conceptualization of addiction risk and protective factors. The partnership team will share highlights from their current work, training prevention professionals, and other caring adults across the country, as well as the organization's free resources for families. With us today is Corey Hammond, Partnerships Director of Prevention Services, and Linda Richter, the Senior Vice President of Prevention Research and Policy. So I will let you two take it away.
Amazing. Thank you so much, Carrie and Sue, and thanks everyone for having us this afternoon. Let me pull up my slides and get this going. I know I gotta switch views. All right. Um, so as Sue mentioned, we're going to talk about an earlier and broader approach to substance use prevention. I'll tell you a little bit about Partnership to End Addiction and what we do for those of you who aren't familiar with us. And hopefully you'll see that the mission of Partnership and the mission of National DEC are very much aligned, and that I think we're all working towards similar goals. So if you haven't heard of Partnership to End Addiction, I know Sue gave a brief overview, but we're a national nonprofit. We're on a mission to transform how our nation addresses addiction by empowering families, advancing effective care, shaping public policy, and really just changing culture. So our goal, I think all of our goals, is to save lives and improve drug and alcohol related outcomes for young people so that they can live healthy and addiction-free lives. Um, and so our main priorities, we have three main priorities. The first is to keep youth substance free for as long as possible. This is really kind of what Linda and myself do. We work on Partnership's prevention team, which focuses on providing training and technical assistance for schools and community organizations. So we're really helping the helpers. We serve adults. Um, the second priority is to increase access to effective treatment for young people. We want to ensure that the latest research is incorporated into treatment practice. And to that end, we have a whole clinical research team and we have a clinical training academy where we train clinicians on best practices in youth substance use treatment. And we're trying to eliminate barriers to high quality care. And then our third priority is to empower families as agents of change. So we want to help families learn practical ways to prevent or respond to substance use. Again, Linda and I do a lot of that on our prevention work. We want to provide parents and families with clear, trustworthy information. I'll share a lot of our resources at the end of this presentation. And we want to train providers to involve families in the treatment process. We know substance use treatment for adolescents is a lot more effective when the families are involved, and so we do a lot of work in that area. We also have a lot of direct to family services. I'll go through them again at the end, but really providing information, resources, skills, training, and direct support to families that are affected by a loved one's substance use. This is our small but mighty prevention team at Partnership to End Addiction. Again, I'm the Director of Prevention Services. Linda's going to come in a moment. She's our Senior VP of Prevention Research and Policy, so you'll hear from her about halfway through. And then we also have Janelle Robinson, who is our Associate Director. And I'll share our contact information at the end. If you like what you hear and want to get in touch, we're happy to stay connected. And so we're talking about our two-pronged approach here, early prevention and really broad prevention. So the first half of that is the early prevention piece. So I'm going to talk a little bit about what we mean by early prevention. I think all of us in this room probably know what prevention means and have an idea of prevention strategies, but we also know that it can mean a whole host of different things. So when it comes to substance use prevention, I'm sure we can come up with a lot of different strategies. Is it helping parents to have conversations with their kids about drugs, but also stress or anxiety? Is it school assemblies that we've all had where students are listening to lessons from those in recovery? Is it locking away prescription medications? Is it the prohibition of advertising for addictive substances near schools where kids hang out? Is it, incorporating lessons into biology and chemistry about what addictive substances do to the brain? Yes, it's definitely all of these things. We know that these are preventative strategies. But prevention is also so much more than that. It encompasses the actions and interventions that, on their surface, may not have a whole lot to do with risk behaviors like substance use themselves. So it's things like access to affordable childcare for new parents, making sure that parents have access to things like diapers for new babies so that they're less stressed and able to bond more effectively. It's policies that reduce poverty and guarantee health insurance coverage. It's school programs that build resilience in young people and their social skills and their emotion regulation and offer some mentorship. It's engaging and accessible after school and weekend activities. It's ensuring that we have safe neighborhoods and strong community connections. Um, I think we know that all of these things are also prevention. But despite the logic of all of these examples, when most people think of substance use prevention, they're thinking of the school assembly, they're thinking of the lessons about drugs in health class, they're thinking about scary images of a smoker's lung or scary PSAs that they saw as a teen. That's what most people think of. And so we're really trying to spread the word about what a much broader and earlier view of prevention looks like. And so our whole philosophy centers around this early and proactive type of prevention, what we would call an upstream model of prevention. If any of you in this presentation have a public health background, you know that public health people love the river metaphor, this idea of upstream versus downstream. And so we just don't want to treat mental health and substance use and behavioral symptoms when they emerge, but really create the healthy environments necessary to prevent the risky behaviors in the first place. And so this river metaphor comes from the Desmond Tutu quote. There comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in the first place. And so by intervening earlier and more broadly, we can better prevent risk behavior in adolescence and all of those negative consequences. And we can ease the burden on those who are doing direct services with young people, those who are going to fall in the river despite our best efforts in prevention. And so, to come back to another water analogy, we think about the risk cascade. And so, a lot of this is why we want to focus so early when it comes to our prevention strategies. So, all of these different risk factors throughout childhood build on one another and form a cascading effect as a child grows up and moves through different stages of life. So, risk factors in infancy and toddlerhood, things like parental abuse and neglect or toxic stress in the family, can lead to risk factors in early and middle childhood, like a poor parent-child bond, low self-regulation, early signs of mental health and behavioral disorders. And then these interact and lead to risk factors in late childhood and later adolescence, so low school attachment, affiliations with risk-taking peers, and so on into adulthood. And so, if prevention's not implemented early enough, these risk factors in a young person's life can build up and compound the likelihood that mental health and behavioral health problems, including substance use, will emerge over time. And so, we call this the risk cascade. I'll talk about it a little bit later, but the good news is that protections and protective factors also build up in a cascade. I just got the notification that my internet is unstable, so if I pause, go out, somebody um, And so, a critical factor when it comes to early prevention that we need to think about is called ACEs, and these are adverse childhood experiences. I'm assuming that everybody in a national DEC conference and a national DEC call knows about ACEs. That's your bread and butter. Um, so we know that these are the experiences that are known to be traumatic and detrimental, physical abuse or mental health in the household. But it also includes things like sexual abuse, having a family member who's incarcerated, or a mother who was treated violently. And unfortunately, these are very common. About 35 million children in the US have had at least one of these adverse childhood experiences, and over 76% of students have had one. 18.5% of young people have experienced four or more. Um, and the important part about this is that the more a young person experiences, the higher their risk becomes for a whole host of negative outcomes that we're concerned about. There's a dose-response relationship between the amount of ACEs that somebody has and their risk as they grow up. For instance, I'll show you a graph on the next slide, but a student with one ACE is 2.2 times more likely to misuse prescription opioids compared to a child with zero ACEs, for example. Unfortunately, the strongest association is with suicidality. Students with four or more ACEs are 12 and a half times more likely to attempt suicide compared to those with zero ACEs. So there's a really strong relationship between ACEs and risk. Again, here's the graph that shows this. ACEs are associated with increased risk for multiple types of substance use and substance use disorders. And the more ACEs a person has, the higher their risk. So you can see the purple bars are for the students who have had four or more ACEs. So ACEs increase the risk for likelihood of being a current smoker, alcohol use disorder, having ever used illicit drugs, and having ever used injected drugs, as well as earlier initiation of substances, which I'll get to, which is a really important risk factor. Some of the other key risk factors or vulnerabilities that we're concerned about, aside from just ACEs, are things like a family history of substance use or addiction, of course, frequent moving or life transitions, having a poor parent-child relationship, low school attachment, mental health or behavioral problems, living in a disorganized, high-crime neighborhood, having a marginalized identity or undergoing discrimination in their circles somehow. Definitely things like bullying or peer victimization. But we know that, no single one of these risk factors is 100% going to cause an individual to become addicted to substances or have other serious problems. And it's absolutely possible for a young person to have many or all of these things and never develop a substance use disorder or a mental health disorder. But we do know, research shows that the more of these a young person experiences, the higher their risk becomes. And so I'm talking a lot about early prevention, but we know that most of our prevention efforts right now focus on adolescence, which is 12 to 18-ish years old. And the reason for that, there's a good reason for that. And this is a period of intense and transformative brain development. This is the time where youth are taking risks so that they can encounter new experiences and learn from them and be better prepared for adulthood. But we also know that that risk-taking developing brain doesn't have the full brakes yet. It's not fully equipped with the cognitive controls that it needs to rein in some potentially harmful behaviors. It's not always great at weighing risks and consequences. And we also know that substance use during adolescence can induce changes in the brain that persist into adulthood and underlie a lot of our risk for addiction. And so adolescence is the developmental stage that's most vulnerable to starting to use substances, but also the most vulnerable to the consequences of substance use. Um, and here's some data that supports this. We know that the age that someone first uses substances has a direct relationship to their risk for substance use disorder later in life. Those who first use substances before age 18 have a 1 in 4 chance of going on to develop addiction. Meanwhile, those who wait to use after age 21, that risk drops to 1 in 25. So that's a huge risk difference just by delaying substance use potentially a few years. So this is why we need to get in and start prevention as early as possible. A little bit more data that show this. You can see that the earlier someone starts to use substances, we have alcohol here on the left and marijuana here on the right, the higher their risk for developing an addiction to that substance as they grow older. And so we really want prevention to start before someone starts using substances. And so this is data from SAMHSA, Chris Jones out of SAMHSA. You can see that the vast majority, this is lifetime non-use of substances. So you can see as kids get older, non-use goes down. And so the vast majority of 12 to 13-year-olds are not using substances. We can see that that dark purple bar is 12 to 13-year-olds. So almost 92% are not using nicotine, 92% are not using alcohol. And these numbers get much lower as kids get into their late teens and then even the 20s. So we have to get in there before they hit their teen years to really lay a solid foundation for effective prevention and interrupt this decline in not using substances. All right, and so now I'm going to pass it to Linda to go into the broader side of this argument.
Thanks so much, Corey. Yeah, so you covered the earlier part, and now I'm going to talk about the broader part. Contrary to the classic approach to prevention, we know that much of what we can do to prevent substance use and related problems on the surface have very little to do with substance use or seem not to have to do with substance use. Instead, these broad, effective approaches to prevention focus on healthy youth development more broadly. You can go to the next slide, Corey. So we showed a list of risk factors, and here are some of the protective factors, and these should be familiar to many of you because they pertain, again, not just to substance use, but to a whole range of important qualities of healthy youth development. So effective parenting, a nurturing, supportive home, positive peer norms, always, we mention again and again, and I'll talk about it more, a trusted adult. But in talking about a broader approach to prevention, you see that none of these are explicitly about substance use. We can see that these are related to substance use, but many of them point to these larger socioeconomic factors that play a really important role in a young person's development. And if we ignore these things and only focus on the very substance-specific issues like accessibility to nicotine, alcohol, or drugs, or if a family member has a history of addiction, we are missing the bigger picture. We do need to focus on those things as well, but it's just not enough. We have to have a broader perspective. And research shows that protective factors like these can really counteract the effects of many risk factors. In fact, there's a good bit of research showing that even one protective factor, if it's a strong one, could shift the trajectory for a child who may have a whole host of risk factors weighing them down and working against them. So something like a really good teacher, improved parenting skills, a good mentor, these can each have make an enormous difference in a young person's life when it comes to substance use risk. You can go to the next slide. And back to that water metaphor, or river metaphor that we like, just like there's that cascade of risks, there's a cascade of protection as well. And different protective factors emerge and are important at different phases of a young person's life. So for example, as you can see here, during infancy and early childhood, things like proper nutrition and healthcare and consistent nurturing support from parents are most important. They help develop strong bonds and a sense of security and safety for a young person. As a child reaches preschool or goes on to middle childhood, we want to equip them with social skills and a sense of connection to their school and larger community. Things like self-regulation skills and feeling like they matter to the people around them go a really long way in helping kids overcome stress and adversity in their environment. And then when they hit adolescence or early adulthood, kids will become more independent, they'll develop a sense of self, and we really want them to take reasonable risks, step out of their comfort zone, but to do that safely. And throughout, one of the most important protective factors, as I mentioned, for a child is to have at least one strong, trusted adult in their life. And all of these different prevention stages build on each other and provide protection as kids move through each stage of development. So we are also thinking about prevention as spanning generations. And this is really an important thing to keep in mind. We talk a lot about intergenerational risk, but the concept of intergenerational protection is really not paid enough attention to. If we support children now and help to ensure that, they become healthy, developing adults, then in 10, 20 years, they're going to have children and we can, bank on the fact that those children will be in a better place when it comes to substance use and a whole other range of outcomes. You can go to the next slide, Corey. Thanks. So we'd like to show this sort of balance or seesaw or fulcrum because this is what the science of prevention really comes down to. It comes down to reducing risk factors while increasing and bolstering the strength of protective factors, and how even one strong protective factor can really offset the risks that may exist in a child's life. And while we might not be able to change a child's family history of addiction or undo adverse childhood experiences, we can support young people in these ways to help tilt the risk protective scale back in their favor. You can go to the next slide. So what we really advocate for in our approach is to take a health versus punitive approach. And that sounds very logical, but unfortunately, it's not how things are often conducted when we talk about prevention. So if you really have a deep understanding of the life circumstances and the often understandable motivations that drive youth substance use, you could really appreciate why a health-based approach to interactions with young people, as opposed to a punitive approach, is more effective. We teach this to parents when we present to them, but also to teachers and counselors and really anyone who interacts with kids. But if you take a health-based approach, what that means is you're focusing on promoting children's health and safety, not punishing undesired or unhealthy behaviors. It means recognizing that young people's undesirable or unhealthy decisions typically happen for rational, developmentally appropriate reasons. And it means understanding the motivation behind these behaviors so we can help children satisfy those needs with healthier and safer alternatives. And we can emulate this with our own interactions with young people and teach parents and other adult supports the benefits of relating to children in this way. One of the most important protective factors, we hear this word a lot, it's a key aspect of this health-based approach, and it's resilience. Essentially, the idea is that what we want to do is help kids develop the capacity to withstand or bounce back from life's inevitable challenges and difficulties, and ideally come out stronger on the other end. So resilience is comprised of skills like strong social skills, emotional skills, so that they can successfully navigate difficult situations, so that they could benefit from social interactions and opportunities. It involves good coping skills in the face of challenges. And really important is a sense of purpose or mattering and orientation toward the future. And although social and emotional competence comes more easily to some kids than to others, you're not either born with it or not. These are skills that could be learned, they could be practiced, they could be improved upon. It's a very dynamic process that can change over time. And even children with very high levels of ACEs or who face broad societal challenges, they could thrive in the face of obstacles if they have good coping and self-regulation skills. Another key protective factor for preventing substance use and other adverse outcomes that doesn't directly relate to what we typically think of as prevention is the development of the social and emotional skills. And of course, that's become more broadly accepted now, also fought about now more often, but essentially it means the confidence that you're capable of managing your emotions and that you can feel and show empathy for others. You can establish and maintain supportive relationships, and you can responsibly accomplish goals. Although social and emotional competence comes more easily to some than to others, again, these are skills that could be learned, they could be practiced, they could be fostered, they could be improved upon. And when children learn to treat others with kindness, to express their feelings honestly and respectfully, what happens is you get a feedback loop where people respond to them well and their confidence improves, and then they have healthier and more adaptive social interactions going forward, which in turn strengthens these skills and this social and emotional competence. So it's a really important positive feedback loop to provide kids with these skills so that they can continue to have healthy social interactions. Resilience also is the ability to recognize, control, and express one's reactions and emotions in a measured and appropriate way. Never by suppressing unpleasant feelings or telling kids that they shouldn't feel a certain way, but learning to recognize those feelings as important clues to their reactions to an experience and understanding the experience as one that should maybe be avoided in the future or better managed somehow. If a child experiences joy, for example, from something a parent thinks is undesirable, parents could teach them that even though it feels good, it isn't really healthy or safe in the long term. So think about something like riding a bike on a nice day without a helmet. It feels great, but we know it's not good for us. Or driving fast, like that's kind of fun, but we know it's unhealthy. So acknowledging the good feeling that can come from a risky behavior, while at the same time putting it in the context so the child understands why, on balance, it's not a good thing to do. Or if, a child feels frustrated or angry in the wake of an experience that is known to be healthy or safe, parents can help them understand that it has a benefit, even though initially or temporarily it produces a bad feeling. So think about eating a vegetable that doesn't taste so good, or skipping a party or something fun so that you could study for an important exam. It's something you wouldn't want to do. You may feel frustrated and angry, and that's an okay feeling to have. But we could teach kids to express those feelings and experience them in a balanced way. And then coping overlaps a bit with resilience, but essentially it's this ability to deal adaptively with a problem or a challenge. So people who cope well, they learn from imperfections, flaws, and mistakes, and they're able to do things like apologize and forgive others and be honest about their own limitations. And here, adult modeling is really important, especially when it comes to apologizing to kids for your own mistakes and forgiving kids for their mistakes. Too many adults are reluctant to do that. They think if we show, some sort of weakness like that, that it's going to come out in a negative way for the child. But it's actually one of the best things we could do for kids is to show them You don't have to be perfect. You can make mistakes. Just acknowledge it and do better and move on. And modeling also comes into play here in terms of caring for oneself and seeking help when you need it. That helps kids learn that they don't have to have it all together. They can have a problem and they could seek support to help solve it. And that's really important for coping skills as well. And finally, feeling connected to peers, to teachers, school staff, community leaders. It's super important. Kids, there's just tons of research showing that kids who feel connected to their peers, to school, to their community, they're significantly less likely to experience substance use, mental health challenges, sexual risk behaviors, and violence. There's good research showing higher self-esteem and reduced emotional stress, depression, anxiety, and suicidal ideation in kids who have strong connections like these, lower prescription drug misuse, illicit drug use, lower marijuana use, reduced sexual behavior, less violence victimization and perpetration. So this sense of connection and belonging, as opposed to social isolation, loneliness, not feeling like you matter, not feeling like you fit in, not feeling like you have a role to play in your peer group or in your community. We put it simply like not feeling like people won't notice if you don't show up one day. Those are all super important protective factors for a young person for substance use and a whole range of risk factors. I think now I'm going to send it back to you, Corey, if your internet is stable.
Yep.
Yep, you're good. Okay, thanks.
Yeah, thanks. Again, if I go out, someone
I'll jump in.
give me a sign. Um, and so trying to kind of like wrap up these two sides, the earlier side and the broader side, what can we do to support this kind of approach in our schools, but also our larger communities? And so the limitations of our current approaches, as Linda said, the aim of prevention is to try to mitigate risk factors and strengthen protective factors within individuals, but also larger families and larger communities. But our traditional approaches mostly start in adolescence, which we know is a little bit too late, where we really want to start in early childhood when those seeds of risk and resilience are planted. They only focus on reducing risk, not so much on the health promotion side of things. So we want to promote health and resilience. They only target the child, not the larger ecosystem. So we want to make sure that parents, schools, and communities are involved. And they only address a really small portion of relevant factors when we know that there's a lot broader social determinants of risk and protection that are important to intervene on as well. And so the importance of early prevention. We know that prevention that is early and broad and proactive works upstream to prevent substance use and risk behavior. We know a lot of parents and individuals are worried about all of these different emerging drug trends that are coming up. And the problem is that there's always going to be a new substance. And so, with all of these new and emerging substances, it can feel really overwhelming to know what to do to keep young people safe. There's always something new for us to fight against. That's true, and that will likely always be true. Our drug landscape is forever changing. But something that gives us hope is going back to this upstream approach because the need to prevent risk behavior before it happens doesn't change with new and emerging drug trends. The risk and protective factors that we intervene on are the same, regardless of whether we're trying to prevent marijuana use or violence or sexual risk behavior or opioid use. So we don't have to change our approach to every new drug that comes on the market. And so we can do this by building resilience, having strong social and emotional skills in young people, coping skills to navigate life's challenges, and a sense of purpose or mattering to the people around them. And so broadening the focus. Our current efforts are necessary, but not always sufficient. So we want to broaden our interventions to address other factors besides just the substance use. We want to provide a more comprehensive approach to take some of the burden off of parents and caregivers. We know that parents and caregivers are so, so important, but they're not the only adults that matter in a young person's life, and they're not the only people that can make a difference. And so by having an earlier approach to some of these primary prevention strategies, we can take some of the burden off of school counselors and clinicians and therapists so that they can really devote their resources to those at highest need. And so we really tie all of this together with the idea of the Swiss cheese model. We can imagine different layers of protection, loving parents, community support, our economic safety net as slices of Swiss cheese. They provide protection, but they have holes in them. Each one's not perfect. So they have these holes where risk factors or adverse events could get through and negatively impact our beautiful adolescent on the left here. But if we layer all of them on top of one another, so we have 7, 8, 9, 10 layers of Swiss cheese, those holes get covered up and they don't matter so much. And we end up with a strong layer of protection. And so that's what we want to do. We want to fortify as many of these different layers as we possibly can. So this is our integrated approach. We're trying to recognize and address all of these different risk and protective factors at all of these different layers. So we're teaching parents the skills that they need to try to have safer and a more health-based approach with their young kids. We have fulfilling and challenging after-school activities for kids. We want to make sure that our neighborhoods are safe and that kids are getting screened by healthcare providers. All of these things can provide protection and reduce the chance that any one risk factor is going to put a child on an unhealthy trajectory. And so another part of our approach, and this early and broad aspect of prevention, is making sure that there's a prevention workforce that is well educated and well equipped to do this work. And so that's a lot of what Linda and myself do. If any of you are going to be attending the National DEC conference in Vegas in May, I'll be going into a lot further detail on some of our work in this area. I'll be talking about how to use opioid settlement funds to bring early, broad prevention activities to your local communities. And so a big part of that is equipping the prevention workforce. And so here on this slide is some examples of the types of training that Linda and I give to prevention professionals across the country. So we've developed a big curriculum, and individuals or community groups can pick and choose topics that they're interested in. And Linda and I are the ones who give trainings to a whole host of groups. And so a lot of, all of our trainings are rooted in this early, broad approach to prevention. So it keeps coming up over and over again. And so now I'm going to go more into some of the tools and resources available through Partnership to End Addiction. A lot of these are just going to be free resources on our website. So drugfree.org is our website. There's a lot of information on that website, so much so that it's kind of overwhelming at times. But for those interested in the prevention side of things, we do have a whole host of prevention resources. A lot of them directed to parents and caregivers that are kind of looking for some information on what is normal, what is going on with my teenager, why are they acting this way. They can find a lot of information for their questions on the website. We have a lot of really in-depth guides for families if they want to learn more about specific substances that they're worried about, if they want to learn how to raise resilient kids, we have a guide for it. And again, these are all available for free download on our website, drugfree.org. We have a full family resource center. This was kind of a new development on our website where we have packaged kind of everything that a family might need all in one spot. So we have the prevention and early action side of things, communication skills, trainings for parents on how to help change behavior in their household, treatment and recovery resources, and then self-care for parents and caregivers that may be going through kind of a tough time. We have a substance use risk assessment tool. It's now called the prevention checkup that parents and caregivers can use to get a kind of a risk analysis of what might be going on, trying to figure out if their child might be at risk for substances and what they can intervene on to make a difference. So it's a quick survey, it takes 5 to 6 minutes to complete, and then they get tailored resources and tailored feedback on what they can do to make a difference. It's also available in Spanish. And then some of our direct services for families. So, for families and caregivers that are concerned about a loved one's substance use, we have a helpline where they can immediately get connected to one of our helpline specialists. So, they can do that by phone, by email, by text, on the computer, and they can get one-on-one help support immediately. We also host online support groups that are led by our parent coaches for parents and caregivers. We have personalized text messaging programs if they want some kind of steady stream of tips and tricks or help. We have text messaging programs for that, and our self-paced trainings for parents. And then finally, for those in the room that work for nonprofit organizations, which is maybe a lot of you, we have our Community Partners Network. So if your organization would like to join our Community Partners Network, I'll have a QR code on the next slide. And so we currently have over 370 partner organizations nationwide. And so this is just us getting together a network of like-minded professionals who are doing work in youth development or substance use prevention or mental health, and really expanding everyone's reach and sharing, kind of spreading the wealth of knowledge that we all have. This If your Zoom screen is like me, then the people are maybe covering up the QR code, but the QR code is there, where if you're part of a nonprofit organization, you can sign up and be a part of our Community Partners Network for free. And we will share kind of monthly resources with you. We have pretty frequent community partners meetings, kind of like this all hands on deck meeting. It's a resource hub, a lot of good stuff there, and it's free to join. And so I hope that some of you will look into that. And after this, if you want to learn more about it, please feel free to email myself or Linda. But now we have some time for any questions if anyone has any. I'll put up our contact information. If you want to get connected with us later after the fact or have questions that come up, after this webinar is over, please feel free to reach out. And then again, as always, drugfree.org is our website. But yeah, just thank you so much again, Carrie, Sue, and team for having us. And if anyone has any questions, we're happy to chat.
Well, I would like to thank you, Corey and Linda, for your presentation. So much great information in there. I think if people want to put a question in the chat, we can share that with Corey and Linda that way. We do have to be wrapped up by 3 o'clock because we have another meeting right after this that uses the same link. So just wanted to let you all know that.
I might ask a question while people are thinking about your questions to throw in the chat, or you're welcome to unmute and ask your question too. I just had a question about the substance use risk assessment tool. Is that available to anyone and everyone? How best for us to help educate people about that and how to access that?
Yeah, so that's another one that's available just for free on our website. It's gone through some different iterations, and so I think the homepage might look slightly different than what I showed. But that is a free resource available for just anyone on our website who would like to use it.
Nice. I do think that's something that a lot of our DEC alliances might be questions that parents are asking or community members are asking. And so that's a good tool that we know that we can now refer them to and be connected with. So I could see that one coming up. I also loved the Swiss cheese analogy. I'm like, deck alliances are Swiss cheese. We're one of those
Yes.
layers in there. We're helping catch stuff. And yes, there's gaps and holes, but when we make, more partnerships and have more relationships with people like Partnership to End Addiction, that's helping add more layers. And so I loved that.
Absolutely. Yes.
Any questions coming in that you're seeing yet, Sue?
Nope.
Not yet.
A thank you from Jill Pearson, Dr. Jill Pearson. So
I just put the link for the updated risk assessment. It's called Parent Checkup, as Corey mentioned now. It's in the chat if anybody would like to grab it.
I'm
thank you,
grabbing it.
Linda.
Thank you, Linda.
And
I
and we
don't
do
have,
want to make the point about that just real quick. I'm not sure if you mentioned this, Corey, but it's not meant as a diagnostic tool in any way, and we don't present it that way. It's really just to kind of let parents get a sense of, we used to call it how worried should I be? Like, is
Okay.
this behavior kind of okay within the realm? Is it something we should sort of take a closer look at? So that's kind of how we think about it.
hi, my name is Jenny Ebert, and I just wanted to say this information is fantastic, practical. Just it is something when I go and give presentations in my communities, parents are always asking for additional resources. So I love that this is just something that is 100% put together for them. They can acknowledge all of the things, not just, substance misuse, but just, like I said, just so much relevant information here. So just wanted to say, I really appreciate your guys' time and the information.
Really appreciate that comment. And I'll just add also, if there are any slides that you saw that you think could be helpful for you when you talk to parents or to other professionals, you could just send us an email. We're happy to share them. We are not possessive. We'd love to get this information out to anybody who can use it.
You.
I just wanted to say I particularly liked your Linda, I think this was part of your portion of the presentation, but talking about coping skills and how important adult modeling is for those, and how many times we as parents might make a mistake or do something that we see later could have been done differently or better, but miss the opportunity to share that with our kids. So I think that was a really important point.
Thank you, Susan. And if I could just add to that, because you just reminded me, something that comes up a lot is even when, as a parent, we do something to our child that we regret, we often feel like we don't want to admit to that because we don't want the child to have the win or feel like they lose respect for us. There's just so much evidence that the child gains respect and also learns so much from that if you kind of cool down, let's say, after you have a little explosion at your child, and then go back the next day and say, hey, not so proud of myself how I handled that, or maybe I could have handled that a little better, or I had some time to think about it, and I'd really love to, have another chance to talk about this with you. Kids are so forgiving and open if they feel that somebody's actually doing it from a place of care. So, thank you. Yeah, repair is transformative. Agree, Jill. Thank you.
Mhm. I just wanted to remind everybody too that this recording will be on the National Alliance for Drug and Endangered Children website within the week. So you can access it there and revisit anything that Corey and Linda covered or reach out to them directly. We've got their contact information right up there on the screen. Or share the presentation with anybody else you think might benefit from it. Okay. Any last minute questions?
Must mean you guys covered everything so well. So that is
Yes.
a good thing. It's always good to have more tools and resources. And
That's
every time I
right.
talk with you guys or come across your information, I'm always taking more notes and looking at more things. And so I am grateful for this new partnership that we're building amongst our organizations and that friendship that we can have so we can help so many people across the nation. So thank you so much for being here today and participating. we look forward to having you at our conference in May, and so everyone can meet Corey at least in person. I know Linda's not able to come, but meet Corey in person and to learn more in person when we're there.
Yeah. And thank you for the opportunity to present to your group. We appreciate it.
Absolutely. Well, thanks so much, everyone. We appreciate you being here, and we'll see you in April on our next All Hands on Deck call. So have a good day.
Thanks again.
Thank you.
Great.
I hit there. I have to hit the right button to let everyone in. That helps.